Hi, this is the Maryland Department of Health, and today we're going to be talking about getting ready for the Maryland Primary Care Program. Specifically, we're going to be talking about the application process for the care transformation organizations. So first off, here's the eligibility for CTOs. As in all CMS programs, you'll have to meet program integrity standards. You'll have to meet the requirements of the participation agreement. And in the application process, you're going to need to submit letters of support and commitments from your clinical leadership, as well as from a practice that you've worked with in the past to support them in the care transformation process. You also need to commit to submitting care delivery practice reports, budget reports, and other requirements as described in the participation agreement. As far as health information technology, the CTO will have to support the practice to meet its health IT requirements, including connectivity to CRISP. Here are the requirements for setting up your CTO. The legal structure of the CTO could be a subsidiary of an existing organization, it could be a brand new organization, or it could be the organization that's already in existence. So for example, a hospital or ACO or health plan or a clinically integrated network, for example, could operate as the CTO. It could set up a subsidiary or a separate organization, or you could have a brand new organization doing this. There will be separate financial accounting required for the CTO, so payments coming in from the MDPCP will have to be recorded and separately from an existing organization. It will also be providing reporting for the program. Lastly, the CTO will need to establish a clinically driven governing board made up of providers who are in the partner practices. This could look similar to the governing board that might already be in place, but it would need to be represented specifically for the CTO based on the providers that are in its partner practices. In terms of how CTOs will be selected, they'll be judged on several criteria: their ability to support practices meet care transformation requirements, their experience doing this, the infrastructure that they have for supporting the program, their capacity and their willingness to work with practice, the scope of their operations, and the scope geographically will be by county, so CTOs will be able to identify which counties they'd like to support throughout the state, and their ability to connect and share data, including connect with CRISP. Ultimately, selections will be made by CMS and by CMS only. The CTO application resources are listed here, a link to the request for application, as well as the actual application portal to submit your application. Lastly, here's a link to our website where you can find out more information on the program and CTO specific resources. If you have questions, please email the address here, marylandmodel@cms.hhs.gov. Thanks for joining us.